Perfect. All right. Well, hello everyone. It's already February, which is crazy, but also so exciting, and we're happy to have you all here. My name is Haley, and I am currently serving as the Student Experience Officer on the Europub Health Students and Alumni Association Board. I'm also a current EPH student, having completed my first year in Dublin and now specializing in the leadership and governance track at Maastricht. I'm also the moderator for today's session, and I am personally very interested in health promotion, so I'm really excited to see how our speakers have worked in the realm and are bringing their insights to this field. So to begin, I'm just going to run through a few housekeeping items. First, the session is being recorded, as it will be uploaded to our channels following its completion. If you missed the very first EPHSA talks, it is now up on our YouTube, so go feel free to take a look at that. We will also be taking attendance. As you saw, I sent out a link. As those who attend at least 3 out of the 5 talks this academic year will be able to receive a certificate. So please make sure that you fill out that Google form that I will be circulating in the chat. I'll also send it out a few times tonight just for anyone who's missed it. So as well, this session will be about an hour and a half long with some time for questions. We'll run through one speaker and then have some time for questions, and then our next speaker, and then questions, so on and so forth. So if you have any questions, please hold on to them and feel free to raise your hand when it comes to the Q&A portion for each speaker. Or you can write them in the chat and I will lead that discussion. So our first speaker tonight is Sajja Singh, and she is a public health professional with over 6 years of experience working with grassroots, youth-led, and women's organizations in Nepal. Her work has focused on sexual and reproductive health rights and comprehensive sexuality education and gender equality, with a strong emphasis on community-led and rights-based approaches. So Sajja also holds a joint master's degree in public health, the Europub Health, like myself, from both the University College Dublin and the Jagiellonian University in Krakow, Poland, in which she specialized in the governance and health systems transitions track. She is deeply committed to advancing health equity and universal health coverage, and particularly in contexts shaped by social and structural inequalities. She's previously advocated for young people's sexual reproductive health rights at both national and regional levels, representing youth voices at major global forums, including the Asia Pacific Forum on Sustainable Development and the Asia Pacific Population Conference and the Nairobi Summit on ICPD plus 25. So with that, I will now hand it over to Sajja to share her screen.
Thank you so much, Haley. And yeah, you might have to stop share the screen so that, yeah, thank you. Let me share the screen. And thank you so much for having me. And it's really lovely to be here. I remember my time when I was part of the EPHSA, and I was also the student experience officer, and holding these sessions. So it's really takes me back to that time. And yeah, thank you so much for having me. So today I'll be just sharing my experience around how I'm working with a non-for-profit, which is the Asia Pacific Resource and Research Center for Women. It's based in Malaysia, and we work for the sexual and reproductive health and rights of women, girls, and young people in all their diversity. So rather than a presentation, it will be more of what is happening right now and how is the context and um, yeah, what more can we do in this changing context that we're seeing? So the presentation that we'll focus on is shrinking funding, growing resistance, and impacts on health and communities. So as we all know, and as we might have, swamped by the news, the global context is changing rapidly. 2025 was a pretty crazy year, to be honest, because there was a lot of things happening. There was election of Trump in January 2025, which really changed everything, not only for the United States of America, but also globally, including Nepal. The policies that Trump in like started in 2025 that had rippled effect in all parts of the world. And not only that, there was a lot of not only in United States of America, but also in different parts of the world, the far right, the authoritarian regimes, they seem to be rising. In Europe as well, you can see it happening. And most recent news yesterday in Costa Rica, the far right, representative, they won the election. So we can see that, a lot of governments all around the world are more driving their government towards authoritarian regime, which is not that great. We also saw a lot of conflicts, war, including genocide in Gaza. And although there has been a ceasefire, but then we also hear a lot of news around still there are a lot of killings happening in Gaza. Not only Gaza, but also Sudan, Congo. There has also been consistent, conflict and war in Ukraine. And we also saw in Asia Pacific, there was new growing conflict in Thailand and Cambodia. So there are a lot of geopolitical tension that is currently ongoing, and keeping up with these news have been really, really difficult because things are changing so rapidly that it's really hard to keep track of it. And something that also happened in 2025 was the uprising that took place in different parts of the world, including Nepal, where I'm based. So there was uprising, especially the Generation Z, which led the movement in Nepal, which overthrew the past government. And similar uprising was seen in different parts of the world, including Indonesia, in Philippines, in Madagascar, in Morocco, to just name a few. So, this is the current state of the world that we are living in, which is really volatile, which is really changing rapidly. It's very hard to keep track of what things are happening, especially with the Trump administration taking different policies. And now that the world is very global, nothing remains within USA. It just impacts globally. In this scene, we can see that, the geopolitical tension is there, but along with that, there is also something that is majorly happening with far-right government coming to power. There is severe funding cuts that is being faced by a lot of different countries. Also, civil society organizations like the organization I'm working with. So, just giving few, numbers here. It was projected that in 2025, the least developed countries were projected to see at least 13 to 25% fall in their net bilateral official development assistance. And 11 OECD countries had announced cuts in their development assistance from the period of 2025 to 2027. And these 11 OECD countries include USA, UK, France, and Germany. And astoundingly, these countries, they account for nearly three-quarters of total development assistance in 2024. So these are really big numbers. And these really shape the global health context and the amount of work that is happening in different parts of the world. As we all know, US had significant reduction in their foreign aid, and in 2026 they will have two-thirds of reduction in funding for their bilateral global health programs, including 50% cut for HIV and AIDS, and no allocation whatsoever for the Global Fund, Gavi, or the World Health Organization. Um, the funding cuts are also expanded to different other countries. There are a group of seven G7 countries who are also together cutting down the development assistance, and they will cut their aid spending by 28% in 2026. Similarly, the UK government has announced largest cut in international aid budget in 25 years. They are dropping their funding from 0.5% to 0.3% by 2027. So all that like funds are being slashed and cut down, but all of this cuts in fund needs to go somewhere. And if we ask where these funds are leading, is towards the defense, as they are using the geopolitical tension, the shifting geopolitical situation as a reason. Many countries, including UK and other countries, are pushing these uh, funding towards the defense, towards military spending. According to United Nations, in June 2025, only less than 17% of 46 billion, US dollars were only gathered by the end of June. So this is really less of an amount that United Nations achieved. But then these countries are spending a lot of their budgets in military spending. And in 2024, only 2.7 trillion dollars were invested in global military spending, and it is projected to increase a lot more by 2025 to 6.6 trillion. But we can see that, there is a significant gap in funding for sustainable development goals for the multilateral system, while there is a significant rise in global military spending. So just here are some numbers just for us to think, what if the governments, instead of spending in the defense of their country, would spend in global health or SDGs or the multilateral system? This could be really, really beneficial, but the current state of affair is not the same. The the Secretary General of UN said, in one of his report that, the military funding, spending in military has not been a new thing. It has been there for a while, but just the intensification of it has a really great risk to just normalize investing this large sum of money in the military. So there is a shrinking funds, but then this is not actually the case because governments actually have the funds, but then they are investing in defense instead of the global health, the public health, and development assistance. Just an excerpt from an article that I was studying is that the financial gap that we are seeing is not accidental. It is actually very deliberate, and it is a political choice that defines security in militaristic terms and deprioritize human needs and ecological well-being. And we must push back against these choices as a matter of urgency. So all of this, but the important thing is that out of all of this, funding cuts and everything, the impact is that the most vulnerable are the ones that get hit the worst. Um, because a lot of this development assistance are directed towards the least developed countries, and these development assistance they are geared towards health and population activities, including health financing. But now that these funding are not there, it really jeopardizes the whole health systems in these least developed countries. As we're well aware that the USAID is dismantled, and before getting dismantled, USAID really supported in combating diseases such as HIV, tuberculosis, malaria, polio, reducing maternal and child death, and also fighting malnutrition, which saved 92 million lives over 2 decades of its program implementation. And USAID in Nepal also did a lot in health promotion and prevention, in immunization. So there was a lot of work in the area of health promotion and prevention as well. But with the disruption of the development assistance, now more than 22 million additional deaths by 2030 is expected, is projected, including 5.4 million children under 5. And with the dismantling of USAID, this could be, 14 million additional preventable deaths by 2030 could occur. Here we're talking about, development assistance, and I just wanted to flag that development assistance and development in itself is very controversial, I think, because of its relation with the colonial, the patriarchal roots that it has, and also like the historical and the current activities that that has made some countries underdeveloped versus some who are developed. But then, here we're not going into that, but then we're more interested in that, like why is the development assistance, instead of going for the global health, it's directed towards somewhere else. For example, the defense, the military defense. But also, another thing is that although there is a withdrawal of development assistance, I think it's not the biggest of issue. Here, the issue with the governments, the countries who are the developing nations, is that the speed of withdrawal is the main issue. It's so sudden, it's so fast that these governments which are already vulnerable, these health systems which are already vulnerable, they don't have, you know, space or time to just cope with the change that they face, or seek for other alternative sources of funding, or fill in the gap, because the withdrawal has been so massive and so quick that it has really taken a lot of time for them to just cope with the issue. So I think that is the major issue that the governments are facing currently. And if I have to talk about Nepal, where I'm based at, Nepal is a developing country, and the around 10.35% of the total health expenditure comes from the external funding, like the development assistance. And it's really, with the absence of the USAID, especially, the government of Nepal and the health financing has really struggled, and it will struggle even more in upcoming years. And in Nepal, people pay out of pocket, and about 58% of total health expenditure is covered from out-of-pocket expenditure. And because of the USAID closure, a lot of programs have been heavily impacted, including the nutrition programs, the delivery of essential health services, programs on HIV and AIDS, and supply chain management, including the demographic health surveys, which takes place every 4 years. So there's a lot of gap that will take place. And more so, um, the thing is that in absence of this aid, and in absence of these programs, the hardest hit will be those who are in the lowest of wealth quintile, who will be forced to pay out of pocket even more, and the fear is that they would be even pushed further towards impoverishment, is what the government's fear as well. And in Nepal, there is also cases where USAID had been funding the antiretroviral treatment therapy clinics, the ART clinics in Nepal, but with the funding cuts, these clinics are non-functional now, and the existing clinics, the government clinics, are only providing services like the HIV test, but not the prophylaxis or any other thing. So a lot of HIV positive people are in the risk of um, going towards AIDS, or even severe conditions. So that is the current state in Nepal. So it's really sad, but then this is the reality of a lot of least developed countries or developing nations who are heavily dependent on the external funding for its health financing and for functioning of its different programs. Now, that was what countries have been facing, but the withdrawal in this funding cuts and have also been severely impacting different multilateral system, more so because of the United States withdrawal from UN agencies. In 2025, United States of America withdrew its fund from UNFPA, and this expanded more this year as it withdrew from all the treaties and conventions and all the UN bodies. Um, but funnily, the US has been only providing 1% of its federal budget. And that was and even with the 1% of its federal budget, it was leading nation contributing to the multilateral system's budget. But now with the withdrawal of the United States, the multilateral system has really become fragile in terms that they don't have funding to function a lot of different activities, which has been really impacting the whole civil society organization, the rights, human rights area, but also it has been creating a gap where anti-rights actors, those who are against gender equality, those who are against women's rights, have been creating some sort of alliance or greater movement to just push back against the progressive agenda. And we can see this because now there is a global gag rule which has been even more expanded recently with implications towards even the expanded global gag rule might impact implementing initiatives on gender equality or initiatives around post-abortion care. So there is a lot of implication with the recent, global gag rule. This is one of the example how anti-rights movement is just expanding its area as we move forward, as there's a vacuum that is created with the withdrawal of United States and its funding from the multilateral system. I just want to plug in the organization that I'm working and like the governments, the non-for-profit organizations like the organization I'm working for, Arrow, is also hard hit because we work for sexual and reproductive health and rights, gender equality. And now that there is very less funding available, it's really a struggle for non-for-profit like us to keep moving forward, keep fighting for the rights of women, girls, and young people in all their diversity. But what we have learned is that it is in these moments where we are faced by adversity. I think it's in these times when community really come together, and it is this in this time that we have to use the resources really strategically so that we can really push forward despite the odds, despite the anti-rights movement, and really push forward the agenda that we believe in, that's sexual and reproductive health and rights. Also, it's really important, more than ever, it's very important now to think locally and also act locally to diversify funds, be it the civil society organization, be it governments. It's really important to just raise funds internally, be creative in the financing, and also investing in health promotion and health prevention programs and activities. So yeah, that's all. And I want to conclude with this quote by Margaret Mead. And never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. So thank you so much for the time and thank you so much for listening. Thank you.
Thank you so much for that, Sajja. That was a very, very interesting topic, and I think something that is very relevant today. Obviously, with everything going on. I myself, I'm Canadian, so not quite close, not quite the US, but we're feeling the effects from something. So it's very interesting to get another perspective on how that impacts not just the US or those close to it, but around the world. So with that, we'll move into our question period. If anyone does have a question, please feel free to drop it in the chat or to just raise your hand, and we can have those questions asked. I will maybe start. Um, you did maybe kind of touch on it a little bit, but I was wondering if you could maybe talk a bit more about what you think for what affects the like high income countries could face from the lack of funding that is going on globally. Because we hear a lot about, at least like with the US, there's a lot of like, withdrawing all that aid because they kind of feel like, oh, well, it's not helping us, it's, only helping other people. But is there going to be, do you think, like an effect that will be seen on those countries, specifically, let's say like the US, from withdrawing their aid that they will see and face themselves?
100%. I think we've seen multiple times with COVID-19. I think, it's really the whole world is very global and like it's very evident that if we want like if a developed country wants to remain like, healthy or, want to remain as they are, I think it's very important for them to invest in the countries all around the world, that is countries like Nepal, which are developing because we've seen that people don't remain as they are. They will migrate. They will seek other opportunities. They will move. They will, there is always this intent of people moving around. So there will be challenges for developed countries because right now, US is trying to, um, cut the immigration system, So, but I think it will only get worse if the countries really even more focus on themselves rather than thinking globally. So I really think in terms of migration, it will severely impact them because people I've seen and we've seen many times that people don't remain in a single place. They tend to move and they tend to move in developed countries that will really cause issue in terms of conflict, in terms of a lot of different things as well. But also once the global funding declines in the developing nations, there is also chances of diseases and other sort of pandemics arising, which evidently will, spread across these countries as well. So I think, yeah, there is a huge impact on the developed nations if they don't start funding other parts of the world as well.
I think that's some great insights that you definitely bring to that as well. And I think especially with everything going on, and we are thinking so right here, right now, that we kind of forget about the long-term effects of a lot of these things, especially, coming out of COVID, and then now, like you said, about a lot of this military funding, defense funding. So it will be interesting to see how that kind of continues. Um, I do have another question. You did mention the organization that you work for, Arrow. You did mention a little bit about what they do, but can you maybe share a little bit about your journey with that organization and how you got involved in that?
Sure, yes. So Arrow is Asia Pacific. It's a regional organization which where we mostly do is work with our partners at the country level, do a lot of community mobilization, but also equally active in different advocacy spaces, the UN spaces like the Commission on Population and Development, the Commission on Status of Women. So there are a lot of spaces that we are working on. If I have to tell about my journey, I joined Arrow after I graduated in 2024. So I was known to Arrow before when I was working in Nepal. I was known. I didn't knew about Arrow. And when I graduated, I felt like this was the right opportunity. I saw an open call, so I just applied to it. And I had experience in sexual and reproductive health and rights, and the organization does work in this area. So I felt this was a fit. And I actually applied for it, and then that's actually how I got selected, and I'm part of it. But then, yeah, basically, we do a lot of advocacy work, also a lot of mobilization, and also partnerships between different networks and organization within Asia Pacific, and also in Africa as well. So, yeah.
Yeah, thanks for sharing that. I know often with the EPH students, they're always looking at how they can get involved. Okay, perfect. We got a question from the audience. I'll pass it over to Lola.
Hi, can you hear me?
Yes, we can hear you.
Perfect. You mentioned it in the first question. I wanted to ask about the funding cuts. What do you think are gonna be the long-term effects of these funding cuts?
I think it depends on, I mean, I could just, when this funding cuts happened in early 2025, it was really interesting to see different perspectives of different stakeholders, I would say. A lot of people were actually happy that, the funding cuts are actually happening. And now, because the funding does come with a power, right? Like the funder always have a power. So people actually were like, okay, like finally we're free of this, this north south funding partnership. Now I think that time people were thinking like, now finally the South can actually do something on their own and be independent of some sort. So there was a very conflicting sort of notions between different stakeholders. Some were saying, it's really bad, while some were actually really okay with not having it and thinking that it's good. But definitely, as you can see, the numbers, the developing nations really do need development aid right now, and I think for a good amount of time they will require it because to come up to the developed nations level, I think it will take time in, just so I think if you tell about, I can tell from Nepal's perspective, I can see that if the funds are um, like if the funding is still like this for a sustained amount of time, if the funding is withdrawn for a sustained amount of time, I think countries like Nepal will really be hit hard because we saw it in COVID-19. Our system is really fragile. It can break at any point of time. Now we don't have enough funds and we are heavily reliant upon the external aid. Now that we don't have it, the free services that we are having, there are certain basic services which are free. I think these services are likely to even be out of pocket now because the government won't be able to provide it for free. So, and these are the services which are being utilized by the group of people who are most vulnerable, who fall under poverty line. So I think we would see a lot of people push towards poverty and also a lot of issues around accessing the health services. So that's what I see, at least from Nepal's perspective.
Thank you very much.
Awesome. We'll hand it over to Beck now.
Hi, thanks, Haley. And thank you, Sajja. That was wonderful. I mean, clearly some big challenges that we have, but it's really encouraging and inspiring to hear about what's being done, or what can be done. And I think that's very much my question is for people that do live in sort of the wealthier countries, but are seeing what's happening. What can we do to contribute to these sort of community efforts, and how can we show our support, even if we're far away?
I think that's a great question, and I think I'm not sure if I have the right answer or any answer to it. Definitely, I think um, at this point of time, just making sure that you're with some sort of structure or be support of any kind. I don't think it's necessarily the could be certain resource, could be technical resource or technical support that could be given. Also, I think it really depends on how you can engage with your own government, be it local or national. I think that really matters because I remember like in the Netherlands itself, there was in the first election the far right government won, and then for a certain time, the government was far right, but then there was a re-election and the centrist party won. So I think there is also a lot of power in people where you live, and I think if there is influence that you can do I mean, if you come together in large number and push your government, I think that is only thing I can say right now, because I have seen that really helps, and maybe if you could collaborate with some sort of organizations, I think that would be helpful, but I'm not sure. I don't have a perfect answer to it, but yeah, thank you for the question.
Thank you for the answer. I mean, whatever we can do is good, and it's good to start that conversation. And yeah, I think those are really good points. So thanks very much.
Excellent. Great. Thank you so much for having me. It's always great to do these kind of talks. And it also gives me an opportunity to put forward also a kind of my 2 cents that I would want to give you for your education in public health, which is the value of applying system thinkings in health promotion. but also that when applying system thinking or system approaches, there are a few pitfalls. And I can mostly zoom into the pitfalls, but first I want to explain why this is kind of necessary. And it has to do with the fact that there are a few different types of problems. And I like that I was after Sajja, because now I can see that Sajja is going to I will come back to that to show why this is important. Because there are different types of problems, it needs different types of way to look at how we can solve these problems. So I made 3 categories. It's on a spectrum. Doesn't mean that if it's not simple, it's something else. But there are simple problems. Simple problems usually have a very standard way to be solved. If you look at a example of healthcare, it would be, for example, a little cut in the hand that you can save with a band-aid. If you want to look at an implementation example, it would be changing all the pens at a nursery station for those that last longer, right? It's not a huge challenge. There are quite some of that, but there are also a lot of complicated problems. And complicated means that it entails a lot of different things, but they are somewhat predictable and somewhat workable and doable. For example, surgery, which does sound like it can be extremely difficult, is a complicated problem, which means that you could basically write out in a protocol with thousands of steps, even all the possible variations you can find in a protocol, but doesn't mean it's simple, but it's still doable and predictable. The problem is the third category, which are complex problems. And I think you as public health students will be mostly dealing with this, which are, for example, research questions or just questions, policy questions related to how can I get a certain district that is problematic in a city to be more engaged and more healthy? Why is it complex? These are unpredictable. There are a lot of relationships together with these people and the services that are present there, that when they interact, something very unpredictable can happen. And that's where the complexity lies. And I need to warn you that for your kind of study and kind of future work, you will probably deal with a lot of complex issues. Going back to the previous presentation, how certain of these issues has been solved, which are a worldwide problem, will be quite complex. And this complex way of problems needs a different way of approaching, a different way of looking at these problems. Right now, it's not really well taken over by healthcare professionals or policymakers, because usually these are still seen as a very linear way how they go look at problems. So we're going to look at system thinking. Just to give you an example of why system thinking would be necessary, this is an example. I'm sorry, this is a Dutch article, but I really love it. For those who study in Dutch, you probably have remarked that if you buy a plastic bottle or a soda can, that you have to pay a deposit that you can get back if you return it to a certain space where you can get it. When this policy was designed, they did not take in mind that the deposit places were quite limited. People did not want to bring it there, so they threw it into the trash cans. And now something really weird happens, where trash usually was trash. Suddenly, there are trash cans in the street that has value in it. Now, the fun thing is here, the deposit was created to reduce the trash on the street. And by changing this policy, the trash in the street has expanded. Why? People broke open these trash bins to get to the bottles and the cans. There was not a single memo being found when this policy was designed that they saw this as a possibility that could happen. But now, if you look at it, it's a very logical way how it has evolved. And that's what I want to show you with system thinking. Because if you can map a system quite well, you can see what will happen if you want to turn some of the knobs. Let's go to a simple explanation. Imagine your research question would be, what is the room temperature? We can look at the easiest system, right? There's a thermometer in a house. You will set it to a certain degree. Radiator goes on. The temperature rises. If the temperature is met, the thermometer will turn it off. Simple system, right? So if the question would be, what's the room temperature? Simple answer is whatever the thermostat is saying. Now it's become a bit interesting if you put another dimension to it. What about the weather outside? During summer months, you probably don't need the radiator that much. Maybe you don't even put it at all because it's going to be like 25 degrees outside and that's already above whatever you want. Can even make it more complicated. Now there's a person inside that maybe changes his opinion when he's in the room and says, well, I know I set it on 22, now I'm going to set it on 21. Imagine this person is living together. Now there's a discussion what kind of room temperature you want to have. So now there's this other weird feedback loop here. Then in order to reach your house, you need to get like gas, and gas costs money. If these gas prices fluctuate, then of course, maybe the person that sets the temperature would think about, I don't know, maybe 19 or 20 is just fine because I don't want to spend that much. Maybe they have solar panels. Maybe these solar panels don't function that well during winter months or summer months. Maybe they have a neighbor that kind of has a very warm house in which they transpose some of the heat to the other house, and within that house, there's another system going on that kind of explains why it's that warm. And we can go on forever and ever. I can even zoom in on heat receptors on people's skin, or go all the way outside on different solar flares of the space, within space kind of level system thinking. But it comes down that when you see this, and you want to look at certain policy issues, like what would happen if we give an energy subsidy, then it would not really explain the answer yet, because you can see that all these different elements here would then still be controlling a certain input. So it might still be that the debate between two people living together still outweighs that. Or some houses have solar panels in which this energy subsidy doesn't work. And this type of thinking, this overkind type of thinking, really helps getting complex issues and to map them and understand them, what it helps. And this is the first part of the presentation in which I would explain the value of doing so. It's just very unfortunate that it's very hard. And there are a lot of issues that you have to keep in mind when you look at the system. And there are 5 things that I would like you to take home with you, that you keep in mind when you look at the system. And if you can apply that, then I think you will be quite well system thinkers that are ready to really tackle on some complex issues. Let's start with the first one, which I would call the purpose mismatch or a solution mismatch. And that is that a lot of systems usually are defined subjectively. So I'm not going to ask the question because probably that will break the flow of this presentation. But if I ask all the people here, like, why do you have a television? I think the answers would be, I like watch the news, right? I just watch television, basically. The other person says, well, it doesn't do anything for me rather than the Chromecast so I can stream some Netflix or whatever. Some other person would say, I don't do anything with it except from gaming. Like, it's just an Xbox standing there. And then if we talk about certain issues that the television can bring about, if we pick one of these 3 views, the way we're going to look at certain solutions will drastically change. The real thing here basically is that a television does something very simple. It receives a signal, transferred into images and sound. And when you look at a certain system, try to be as precise what it does. If you don't get really to the problem, then you usually have a solution mismatch. And there's another very famous example that can demonstrate that, which is the problem of the slow elevators. This is something that really happened. There was basically a community of homeowners within a skyscraper, and they complained that the elevators were way too slow. So when they all got together, the problem was defined as slow elevators. If you take the problem as slow elevators and you have to think about how am I going to solve this, the easiest solution would probably be speed up the elevators. They go to all this kind of tender organizations that say that, well, I can speed up this engine of the elevator and speed it up. And they almost went for that solution until one sociologist said, what is the actual difference of standing in an elevator for 90 seconds or for 80 seconds? 80 seconds is, of course, shorter, but what is the actual difference? Do we really think that we address the problem there? Now, the cool thing is, if you look into an elevator, any elevator in the world, what do you see? A mirror. Why? Because the problem was not slow elevators. The problem was people do not know what to do when they are in a small space. And mirror solves 2 ways. It makes the room look bigger. Plus, it's a nice distraction when you leave the house so you can check how you look. Before you know it, you're downstairs. So if you would instantly take over a problem being defined without actually addressing the root cause within the system, your solution probably won't work as well. And that's because we are deriving from intentions. It's a European public health system. If a minister of health in a European country would say the healthcare system is there to provide the best possible care for you, which is a plausible claim, because if you compare it to other countries in the world, it is indeed a quite strong social structure. There will still be people in that country that can suffer from a certain situation in which the system doesn't help. So if they look at the television and there is a Minister of Health that says, this system works for you, then it will undermine trust, because it runs not on intentions, it runs on factual structures, different incentives, how the research flows, and different behavioral patterns. If you look at a certain person who is stuck in the system and a single intervention can help them, usually, if you really look at the system, that outcome is very understandable. But we used to look at the systems from the point of view of intentions, what we want it to do, rather than what it actually does. And if we don't do that, then we are optimizing the wrong solution, right? So we got faster elevators without less frustration. We probably get very expensive technology without actually improving any processes. We will tend to go to very quick fixes of lifestyle interventions without actually changing a durable, sustainable, better living conditions. So in basics, no better systems. The second one, delayed or distorted feedback. My shower and my boiler are 2 meters apart, which means that if I shower and I turn on the knobs, the temperature changes instantly. So when I want to go in the shower with the right temperature, it takes me a few seconds to arrange that. And last week I was at a very old hotel in which the boiler was all the way at the cellar and I was on the 5th floor. Now it took me about 7 minutes to find the right temperature to shower because it was delayed. If I want to increase the temperature, it took some time for the water to increase. So it was cold, I twisted the knob, then it was like warm, I went into the shower, the temperature kept rising, it became boiling hot, then I turned it down again, and then it became freezing cold. And after just a few moments, because I didn't get like instant feedback, I found the right temperature. This is something that is one of the core issues, especially in health issues, because healthy behaviors effects only show much later, right? Think about losing weight interventions doesn't happen in 2 hours, in a day, or a week, or 1 month. It happens over several months. And we tend to evaluate certain things, how we solve problems in the healthcare system, much, much too early. One of the big consequences of that, or actually causes, that we have election periods. Every person who's being elected for 4 years kind of want to see the results in 4 years. And that's not how it works. Third one that also distorted feedback is the policy feedback, especially the policy feedback that is colored in different kind of political conventions. So there's noise. Some people interpret feedback differently, which doesn't really work, getting a clear picture of why certain intervention would work. And then you also have wrong adjustments, right? Some things do speed up suddenly, and if you want to correct it as well, you get oscillations, which you have to be careful as well. And the third one is emergence, is that systems have the tendency to display behavior that we did not expect out of its own. Very famous example in healthcare is the burnout cycle. So the moment a burnout would happen within a healthcare institution, that person would leave. The amount of work that has to be carried out by the remaining employees will increase, which also increases the chance of these people to burn out. And when that leaves, then it will shift on. And before you know it, you have a huge burnout cycle. But the thing is that nobody actually designed it. There's not a single manager in a healthcare institution that says, I'm going to design the work in such a way that everybody would leave at one point. But there might be one individual there or two that through other systems they are involved with, personal family matters can happen. It becomes too much, and that burnout effect can instantly change the whole system into pushing everyone out. And it generates these unexpected trends through these interactions, through all these systems that are combined with each other. And you never see them when you write down a system on paper. If you think of something that you would like to do, like want to create something entirely new, and you look at how things can relate, you would always be surprised that when it's put into action, certain behaviors can arise. So my core message here as well, because I know that a lot of public health courses and studies do this, they really focus on lifestyle interventions. Please, I mean, there's nothing wrong with that. Some really work, but you have to understand that certain behavior of individuals is not a result of just the individual self. it's usually the system that has shaped this behavior. Of course, you have people that do not want to receive care, but there are many, many explanations, very logical explanations being caused by the system why that is the case. And it's not an individual choice. And especially when you want to design sustainable and good health prevention practices on community level, on a system level, these are the things that you really have to bear in mind. It really makes you open up for a lot of ideas that has to change. It's usually a system, not the individual. And the fourth one, which is kind of the opposite of the emergence, is that also systems can basically lock in. And I use this image of like a canyon basically comes into existence because of erosion of a river. It just tends to dig out the ways, and then it becomes very hard to get out of that. Give you a prime example, the UK, the NHS is still the biggest buyer in the world of fax machines. Don't ask me why, but it's like something that they really like working with. And there was this one time where there were new fax machines that were much, much quicker. So they tried to implement that, and then none of the people in the hospital wanted to work it. Why? The old fax machine took just amount of time that when you start to fax something, you could walk to the coffee machine, get a coffee, and come back. The other fax machine were way too fast for doing that. So then they didn't want to use it because it was breaking their work routine that had no meaning. It had no really anything to do for what the system was designed. Not saying it's wrong. I mean, people deserve their coffee break, but the system has evolved into some way of working that kind of end up in inertia. This is what we call entropy. And the entropy means that there's variation, complexity. You want to know how can I navigate this? And then two things can happen. Either you do not manage it, you get entropy, it becomes inertia, efficient. There's basically decay of how the system functions. Or you can adapt, get good structures with it, and then see how the system can store these lessons and improve for future capacity. And this is also a core message I want to give to you. The systems always tend to drift to entropy. Every system that you do not maintain will eventually collapse. Think of anything, and basically anything is a system. Think of a bike. If you do not tend a bike, at one point your chain will rust and will no longer move. Everything needs to be maintained. Otherwise, it will end up in entropy. So even if you come with a really great system that is very fair, really works for everyone, if you do not attend it and just leave it alone for some time, you will have created another complex problem that requires another look of system thinking and seeing how you can basically help that. The last one, which is the problem shifting one, also known as the law of the conservation of misery. And the best way to explain this is to look at a country named Honduras. Honduras is a country that is plagued by a lot of hurricanes. So a country with a lot of hurricanes and with rivers in which the bridges keep destroyed wanted to solve a certain problem. And the problem was that the rivers need to be crossed. So if that's a problem, you're going to build hurricanes that are, you're going to build bridges that are hurricane proof. Because if you build a bridge that is hurricane proof, when a hurricane hits, you'll be fine, right? This is what happened in Honduras. The bridge survived, for sure, but the river has basically shifted. So now there's a bridge to nothing, to nowhere. And that's because usually problems shift with the context. And there are a few reasons why that's the case. Usually is that problems that we want to address are just symptoms of a system. So it just arises out of how the system functions. We think that is the problem. And then we're going to address the system without actually looking at the root causes. Also, we got to look at locally. So usually when we look at municipality level, provincial level, there are always some other big differences or big influences that does not being, if that's not being taken into account, you don't get the collective image of that. If you don't have that, of course, the feedback is limited. You're not sure what the systems are by the boundaries, and it usually is the case that context changes faster than solution. So on average, it takes like 15 to 17 years for scientific breakthroughs to be implemented in society. So can you imagine that we are now being stuck in just always, and this is a Dutch saying, mopping with the tap open? If you try to do that, the floor will always be wet. And we are kind of in that kind of vicious cycle that we can't get out of it. So if you do not look at the whole system, the problem will move faster than how we can fix it. There's one thing I would like to end with then. This is from Daniela Meadows, who is basically one of the godmothers of system thinking. It really shows how you can change a system. Now, it's not that she's always giving you these tools that the system will change for the good. It's just that it can change. So some things have a bigger leverage effect than others. So if you look at the first one, like buffer size and constant parameters, that probably comes down to giving people subsidy for buying fruits and vegetables. The whole system still is that we have market and commercial determinants that force people for unhealthy behavior. So if you want to address the issue that people would say, I do not have enough money to buy vegetables or fruits, then that would probably be here around the beginning. It's not big enough to change the system. So if you look at the ladder going on, there are a lot of tools or a lot of different things that you can apply to actually change the system for the better to have a real impact. That's what I was wanting to share with you. System thinking literally needs to be more implemented, especially in very complex societal problems. But not always. Sometimes you just make stuff way, way, way too complex for something that can be addressed easily. But what I can say is that the health promotion and the durable health promotion practices, which you probably will all be quite invested in your future life, requires a hefty amount of this mindset. I do a lot of these things also in the lectures as well. I work this with my methodologies in my papers. If you have any questions or want to have an ideas of cool conference to go to, contact me. This is I would say kind of the what the future of health policy, public health should look like.
Amazing. Thank you for that presentation. I think for myself, it's very interesting to see systems thinking applied to different contexts. Like, at least in our program, we talked a lot about system thinking in terms of specifically like environmental crises. So this is really cool to kind of see how it can be applied in the health promotion sense or just in that health sense. That's not just environmental aspects. So thank you for sharing that perspective. We do already have a question from the chat, and the question is, what health issues have you worked on using systems thinking?
Right, that's a good one. Excellent question. Well, there's one that is, I think, very good to understand, or that's, I think, a nice example to look at. We call it the realist approach to social policies. To give you a clear image about how system thinking really helped to find out if what we are doing there makes sense for the vulnerable population. There was this time in COVID where the energy got so expensive that the government decided to give a subsidy for energy costs. However, in order to apply or not for that, there were some gray areas. So people took in a lot of effort and were in financial problems to get the subsidy. But because of the pressure, the rejection they got, and then rebuttal, it took a toll on their mental health. So the policy was meant to help people basically protect them for a financial blow because of the high energy prices. There were a few groups there that, if you looked at with an actually system perspective, that indeed got the money, which is fine, but their mental health were declining. And this gives you quite some handhelds on how we design these social systems. So that's one example. Another one is, which is also quite prevalent, is how we unjustly digitalize certain aspects of healthcare that has an exclusion effect on certain people. For example, there's a hospital in Amsterdam that asked €1.20 if you wanted to receive mail physically or through an online platform. There are like 22% of the Netherlands that are not digitally, literally that strongly that they can do it. So these people that couldn't do the digital one, like no choice, wanted to do the physical post, then had to pay a fine of €1.20 to get the physical email or the physical message. So if you really look at how people relate, how certain systems create certain conditions, you can find that some systems have a very, very weird effect, which is actually understandable. But knowing then how the system works can help you design it on a very correct way.
I think that's really cool to kind of hear that example from the Netherlands with the mail. Especially that's something that's not like super inaccessible, having that like small fee, but still is a push for the people who can have it for the email. So it's really cool to see that like applied in that sense.
Another example is that people that don't know how to use the digital environment of a municipality, then have to go to the city hall and they have to buy a bus fare to get there. It's like €4. It's also a fine to get there. People can do it at home, those who fit the system, let's say this way. And then we design it in such a way that we now are hampering, or we literally are giving people a fine for something that is very hard to blame them for.
Exactly. No, that's a great insight for that. Does anyone have a question that they wanted to ask out loud? If not, I can go to my question. Oh, Lola has raised her hand. I'll give it to you, Lola.
Hi, my question is about emergence. Is there a way to overcome it or to predict? It's unpredictable, but is there a way to have it in mind
The fact
when
that you already have it in mind, right, cannot help to really address that. But there's like, so emergence and entropy have their actually beneficial sides and downsides. So in European countries, our social structures are hundreds and hundreds of years old. They are very embedded and they have a fair share of entropy and emergence. Now, the downside here is we have huge budget deficits in healthcare, and in order to change that, drastic change needs to be done, which almost goes into the constitution, which means you need 2 electoral rounds of voting. It takes years and years to change it, and then maybe you can make some difference. Not ideal, but there's one very positive aspect of that. And going back to the change America is basically undergoing for the last few years, is that they do not really have that embeddedness. So President Trump had the capabilities of cutting down Medicaid and Medicare drastically, very fast. That makes these system quite volatile. And a fair share amount of entropy can also protect a system for just changing in that sense. But now the balancing act would be is what would I like to see set in stone and what would I prevent to be set in stone or how it can spin out of control. Um, and every system is different and every problem can arise that I cannot predict. So I don't have an answer for that. But the best thing is, is there a way to monitor it? Is there a way to have a fair evaluation of that? How do you get the feedback? Is the feedback unnecessarily slow? Is it unnecessarily fast? Like feedback that's too fast can also be problematic. Think about a car dealer that usually sells like 2 cars a day, and then suddenly he has a perfect day, like 10, 12 cars are being sold. If that guy that suddenly thinks, wow, if this is going to be my average number, and he looks at his storage, he's like, I have to order cars in right now, otherwise I'm going to be out of storage. And he orders like, well, it takes like 2 months. So he thinks, okay, let's get 400 cars, so I'm sure to be well stored for any other customer that walks in. And then for 4 or 5 months, he has a problem where to store all these 400 cars because there was this one little blimp of feedback that he interpreted way too fast. Same can happen in social systems as well. Um, and indeed, sometimes they're like in pandemics. Sometimes you have to act fast. Sometimes you have to sit back. Sometimes you have to act slower. Sometimes you have to act. And it's depends on the problem, but it's the fact that you know how systems can operate and what kind of problems might arise from them already is a big, big issue or a big part of the solution.
Thank you very much. And it's really interesting the protective side of it. I like it.
Yeah, it's not all bad, but it's right now. I mean, we in the Netherlands right now we don't have politics. Well, there are a few, but we don't have politicians that really think like let's get rid of the whole social system. Luckily, but now we have this issue that it just keeps rising. We are now on, depends on who you ask, between 12 and 16% of our brut product being spent on healthcare, of which we know that a big chunk of that is probably not necessary. And if you really want to change that, oh, it's going to take years, years and years.
Thank you.
Does anyone else have a question that they would like to ask? Okay, I'm gonna ask my question then. I just wanted to kind of ask more, once again, kind of like about your personal journey. Like, why did you choose to focus on systems thinking and health promotion in that intersection? This seems as like very unique to me. I haven't really heard about that um connection before, so I'd love to hear what got you into that.
Right. Well, that's the thing. It's been there for like many years, but it's kind of scattered. And the moment you're like in it, you're thinking like, why did I never do this before as well? Because Haley, you're Canadian, right? Did you know there are three associations of system thinking in Canada alone? The weird thing is, up till 2 years ago, they didn't even know the three of them that they existed from each other. So it's a very scattered field in that sense. How did I get into it? I started my research career about healthcare implementation, and now that we look at certain implementation within health institutions, there are already a lot of frameworks to look at all the different determinants you have to keep in mind and how they interact. So that is already some form of system thinking, although you can make strategic decisions on what you want to take into account or not. And when I was done with that, I applied for the job that I have right now, which is a consortium of overarching projects that really look at these system approaches. And the more you dive into it, the more you read, also the more you think like, well, this is a paper, and I read another paper that's basically the same, but apparently it's a semantic discussion. It's out there, and it's really interesting to use the way of thinking. Um, and I kind of love it because you don't have to come up with a hypothesis and say it's true or not true. Now you can say it's partly true because of this and this and this, and it doesn't work for this, this, and this. So you have a lot of space to come up with all your different explanations. Unfortunately, health or just generally policymakers are not really fond of it because they've done this kind of research. So they have like a question, they get these projects to look at it, and instead of getting an answer back, they get 800 questions back. And it doesn't really fit to come up with the all perfect policy plan, which is not the case, but it really shows the minimum of what a system should look like and have enough space that allow really good minded professionals that really strive for the best, have enough support and enough capabilities to really address these core issues. Because there are right now too many people that fall out of possibilities of getting a certain care plan or a care program because they are, I don't know, born 2 months too late. And then we set a strict border that no, that's why you can't participate. That's ridiculous. I do get why we have certain boundaries, but it has been set in that's entropy. It has been set in stone so much right now that it's weird that two neighbors that have like the exact same health condition, one person gets 50 minutes more of housekeeping help and the other one doesn't for whatever weird reason. And this way of system thinking really allows to give you insights in, yeah, to explain it this way. It's fun, but usually when you give if you've really applied for research and you want to present it to people, it's tough to really explain the what's the core message I would like to bring across.
Yeah, I think like you bring up some great things, and I love the example of Canada that it is just it's always talked about, but it's always kind of on the sidelines. So I'm glad that we're getting more research into it and more work done. With that, I am going to bring your session to a close. I know somebody did ask about slides, so if you are able to share those with me, they'll also be included in the recording that will be posted. But I can also send it for those who would like more access. But overall, just thank you again for joining us today. Really appreciate to get some more of that research side of health promotion. So it was really great to hear from you. So thank you again.
Thanks for having me, and good luck with the studies and everything.
Thank you so much. So with that, we'll move into our last speaker of the night, and that is Serena Ryan, and she is a nutrition and fitness professional and a current EPH master student studying last year in Dublin and this year in Maastricht. Her academic focus is centered on health promotion and disease prevention, with a strong interest in translating public health theory into practical action. Alongside her studies, Serena works as a fitness instructor and delivers interactive nutrition workshops in schools and community settings. Her work is grounded in real work engagement, bringing evidence-based health promotion directly into everyday environments. She is particularly passionate about making health promotion practical, inclusive, and relevant to everyday life, ensuring that prevention strategies are accessible and meaningful across diverse communities. So, with that, I'm going to pass the floor over to Serena.
Hello there. First of all, to check that you can all hear me. Perfect. Hi, thanks Haley for having me today. It is truly quite an honor to be a speaker at one of these EPHSA events. So I will keep it short today. I know we're coming up to 8 o'clock in the evening, at least here. I know some people maybe in Sheffield or Dublin are an hour behind, but I don't want to keep you guys too long for this evening. So I am going to share my screen and get started. If I could maybe just get a confirmation that you are seeing my screen.
We can see your screen.
You can see my presentation?
Yes, can see the presentation.
Perfect. Okay, cool. Then yeah, I guess I'm just gonna give a little bit of an overview on kind of the work that I've done in terms of nutritional workshops and also working as a fitness instructor, kind of being more of that practical skill from what we learn in public health into real life scenarios, and also being that bridge between the evidence and the information that we have out there as public health professionals, and also how to communicate that to the everyday people because they don't really know what we know about public health anyway. So to give us a little bit of a more of an information about me and why you should listen to me. In the fields of nutrition and public health, I am a certified, qualified personal trainer. I have 2 companies set up, although please do not stalk me on my first one because I really need to update my website. But with Athletic Proximus last year, I was able to host a few different nutritional workshops for the likes of sporting clubs, and we even went into some schools with some younger kids as well. So that was a really eye-opening experience. And then those who are familiar with rugby, I have worked with the Leinster rugby team regarding nutrition. Also, while I lived in Vienna, I worked with this lovely man here, Florian. He's the national champion for Austria's bodybuilding team. So also very specific nutrition. And yeah, as Haley mentioned as well, I work as a fitness instructor. So combining a lot of that together. So as you can see, I've worked with quite a lot of different people. I've worked with high intensity athletes who are already very motivated. And I've also worked through working in the gym. I've worked with some people who are maybe not as motivated as others. So, little picture to maybe demonstrate what I kind of want to get started off with. We all know that January is pure madness, not even just in the gym, but in all aspects of life. It's the time of the year when everyone wants to get started on whatever New Year's resolutions they have. In a fitness context, you will see the gym being packed. Even in a dietary scene, like you will see a lot of people wanting to improve their nutrition and just improve their overall diets and health. But the statistic actually shows that by March, 30 to 50% of gym goers actually drop out, which is a huge number, and that's 30 to 50%. And we do also see similar results with dietary patterns as well. And I think one of the main themes that I want to highlight here today as well is that we tend to blame the individual for their lack of willpower or that they're not motivated, but we tend to actually blame the real picture, which is the society setting and the infrastructure that we have to support this, because our lives are actually built around, you know, unhealthy eating, around stressful lives. We need to make money as much as possible to be able to afford this life today. So I just wanted to briefly highlight that before getting into my own experiences. This is another picture maybe some of us can relate to. or at least maybe I can give some experience as well from whenever I go to the supermarket. I feel very overwhelmed with the amount of different foods that are available, and even not just the amount of different foods, the amount of different brands and product types within even just one section of an aisle. Um, and then you're always faced with these different dietary patterns that you should follow. Sometimes people say, oh, you should be cutting out carbs, going for a low carb diet. You should be getting enough protein in. You should be following a keto diet, paleo diet. There's all sorts of diets that people follow these days and are becoming a trend. And it's just very overwhelming sometimes. And you don't really know what to do with all that information as an average grocery shopper, I suppose. So that's why my theme as well is meeting people where they are. And I do want to highlight what that then means in a more specific context later on when I talk about my workshops. And I guess this is just more so about knowing your audience. So knowing who you're talking to, where they are, what their circumstances are, what their living situations are. It's very easy within public health to generalize your findings and to generalize your recommendations to the population. But if you just tell people to eat healthier and do more sports, people don't really know what to do with that information. And it's more about translating it into the context and where you are in. So to not waste any time, going straight on to the nutritional workshops that I did offer last year. So a little bit of a background. We gave some workshops to a few football clubs. We gave workshops to secondary, so high school with kids aged between 16 and 18-year-old. And two of those schools were in Dublin, so in an urban setting. And then we had one of those schools actually a little bit further outside of Dublin, about an hour and a half drive away, which is considered a more rural area, and they definitely wouldn't have the infrastructure as you see within a large city. So going into those workshops, it was really insightful to myself, especially as someone studying public health, to structure the presentation and the workshop around what the kids would know or what is known generally within that setting. For example, in Dublin for those workshops with the kids, they were all very knowledgeable, to be fair to them. So they were all very engaged anyway. That was not our problem. But we have these supermarkets in Dublin that have all sorts of food. You can find anything you possibly need or want within the supermarkets in Dublin. If you don't find it in one, you can just go to the next one and you're sure to find it. Whereas when we went out to the country, I really had to think about my workshop and think about, okay, well, there isn't that many supermarkets available to them. And even the supermarkets that are there are very limited in terms of stock and more so, and they more so rely on the markets, the local farmer markets that are there to find their produce. So it was really interesting having to shift that educational workshop into what the kids would understand. And not even kids, this goes for everyone in all aspects of life, could be elderly people, adults. Um, so it was really interesting with that. And then yeah, just following on to the challenges that, as I highlighted before, there's so much information online. There's loads of social media myths, particularly with the young boys in those schools. I saw a lot of them following these influencers that would tell them that you should just eat red meat and steak for your whole life and that you should never touch carbs. And that was something challenging to navigate as well, because as public health professionals, I think most of us are very scientific based. We always look to science to see what the evidence says. We all know that the evidence says that we should actually be reducing our amount of red meats as they can increase cardiovascular diseases, amongst others. And to try and tell the children that when their idols were these big muscular men on social media and telling them to eat meat and not eat carbs was really difficult, but we ended up getting there in the end. I actually ended up showing some of the kids in Dublin as well, some of the studies, and was telling them about the importance of science, and they were very believing at the end then. Um, and then yeah, it's a shift as well from blaming people or blaming certain products and making it a deal between good and bad things, more to this add and adapt approach. So, for example, if we talk about diet, you could often hear in the news like, oh, you shouldn't be eating sweets or you shouldn't be eating chocolates. And yeah, okay, we're blaming chocolates, we're blaming sweets, we're blaming sugar, but in all sense, in reality, sugar and chocolate is not our enemy, is the proportion of it. So instead of, say, having like chocolate every single day, we would try to reduce it, but not eliminate it completely because that creates a really bad barrier to a mindset, actually. Um, so yeah, adding and adapting is one of the better way forward. And then again, coming from the systems only approach, for example, public health professionals stating to the national news saying, oh, we need to eat more fruits and vegetables and do more exercise and eat less sugar is, as I said, really hard to implement for the average person, regardless of where they are. And so we need to shift more to this, like meet them where they are. For example, like I had said, with the one school being more out in rural Ireland, I had to shift my whole entire workshop to what they grew up as the norm because they were not accustomed to the large supermarkets that we have in Dublin. Um, so that's one of the cases that I want to highlight today. Moving on to then things that I've learned through working as a fitness instructor. I know most of those who know me here will know that I'm crazy into sports, and you will most likely see me in the gym, which is funnily enough where I am now. But yeah, what I notice a lot with my clients and also when I was doing personal training before I became a fitness instructor was that people had this idea that you had to go to the gym and you had to do these classes to be able to do physical activity. And that's the wrong mindset to have. I kept trying to tell people as well when I was in Vienna that you don't need a gym membership to get started. Gym membership can quite a lot of times actually be quite a burden for people, either financially, or it can also be a mental stress as well. Some people feel intimidated by the gym and are just not comfortable being in that setting, and that's completely okay. So again, to shift that focus away from blaming an individual for not going to the gym, we need to make sure that the setting that they're living in, that they're spending their time is encouraging physical activity. For example, we have a high crime area case study, and for example, if it is not safe for people to go out in certain areas of there, we could maybe see of a way in which we can highlight the safer parts of the area and maybe have a safety group go on a group walk or run together. Um, yeah, kind of about adapting and overcoming the challenges. I know I also worked with a few clients that didn't have the time at all during the day to go to the gym during opening hours. They were working two jobs mainly. I was like, okay, well, instead of trying to stress yourself out and focus on going to the gym for an hour that you're probably not comfortable in anyway, let's try and do something else instead. And try to bring more movement into their day-to-day lives. If they're working an office job, I used to tell them set a timer on your watch or your phone every 20 to 30 minutes even, or even at least once an hour, for you to remind yourself to get up, do a few stretches, just walk up and down the room, whatever it needs. It's just about the little hints and advices that you can give to people. I know, for example, as well, one of the clients that I worked with, he was a truck driver in Vienna. He used to drive his truck for multiple hours at a time. And he came into the shop where I used to work at and he said, I need to lose weight. I need to go to the gym. I'm going to start doing workouts. I was like, okay, well, when are you going to work out? What gym are you going to go to? You need to consider all these logistics. And he was like, oh, I don't know. I don't know. I was like, okay, how about this instead? He was telling me about his breaks that he spends when he's on these long drives, and he says that he usually just goes to a petrol station, he grabs a hamburger or whatever it was, and he sits down and eats. I was like, okay, let's think about it this way. On your break, instead of sitting down, take 2 walks or 3 walks around your truck. That's already a decent amount, especially to get started off with. Seeing as this man, he did not do much walking at all. So how about you just walk around your truck for a few times and then think about, instead of opting for the burger at lunch, you could try going for a sandwich or something that has a few more alternatives in it and isn't as highly processed. Obviously, I know at a petrol station it's a bit harder to do so, but we were working it out, and the main focus was his physical inactivity anyway. So that just being one of the examples of like integrating movement into your everyday life and not putting pressure or the blame on an individual, because we've kind of created this world, as I mentioned before, where things are getting more and more unaffordable, unfortunate as it is to say. And if we keep blaming people for the lack of motivation, the lack of time they spend doing exercise, then you're just going to create more and more problems, especially mental problems as well, then, where there's going to be self-blame within those people. And yeah, it's really all about kind of trying to figure out the adaptations that you can give to the people. I think in terms of recommendations, it's really hard to generalize it to a big population group, especially because everyone is so different. And we also know that through research as well. So just being aware of who you're talking to and who you're conveying the public health message to is really, really important. And I know I said I wouldn't keep you too long. So just to briefly touch on some of the key takeaways, the main one being shifting the blame away from the individual. It is not the individual's fault to the most extent. We also want to diagnose before prescribing, same as with medications, going to a GP. Ideally, you have a chat with your GP before you get a prescription. It's the same concept that we want to use for these promotion senses. Like, have a look at the population, have a look at the person you're working with, and then tailor your message to that. Be a translator. I really find this challenging or interesting when I was working in Austria. Before I started this public health masters, I have learned a lot through this masters on how to be a translator of scientific evidence to easy, understandable evidence for whatever population group you're working with. Obviously, when I was working with the children, I wasn't talking about working or using models of some sort or using big scientific words. I was making it easy and understandable for them to use. We need to be able to adapt. As we know, life situations change all the time, and just having an open mind and trying to think critically and outside of the box is a key tool for anyone working full stop, but also especially for public health specialists. So I did have 2 references in there in case anyone wanted to have a deeper look into it. And yeah, that concludes the end of my presentation. Again, just kind of touching on some of the key lessons that I have learned. And yeah, I will stop sharing my screen there. If anyone has any questions, obviously happy to answer. Thank you.
Thank you so much for sharing that, Serena. I think it's really cool to see like personal passions and how they're able to like translate into also like what you're studying with health and everything like that. So glad to see that. If anyone the question, please feel free to type it in the chat or raise your hand. I'll start, um, given that we're both in the same program. But I would also love to know maybe how you plan to take what you've learned in the EPH program and apply it maybe further with continuing this passion.
That's a good question. I think through what I've learned, especially also this year as well, I've realized that it really isn't the individual's fault. And I already am doing so much work on an individual basis, and there's only so much that one person can do working on an individual basis. So, for me, I've definitely come to the realization that I want to go into policy making and a preventative aspect. That's also going to be what my thesis is going to be about. If we can change the system that is currently a system that promotes unhealthy living and promotes also capitalism from that as well. If we can change that and start from the system, make the system a healthier place for people to live, then we will have way less issues than what we do now regarding physical inactivity and unhealthy diets. So thank you for that question. And yeah, that's kind of where I see myself working in the future alongside I hope to continue working on an individual basis. But again, as I said, there's only so much you can do on an individual basis.
Amazing. I think that's really cool to hear those too. Oh, Laura has a question. I'll open it up to the floor to you.
Yes, hello. Actually, it's not a question. First, I want to say thank you very much for the presentation, and I'm really glad to see that you are considering these context issues when you talk, for example, about how secure, like which kind of security you could find in the areas where the people are going to exercise. Because I come from Latin America, and for me, it's pretty hard to see that normally the exercise prescribing could be pretty disconnected of the social reality, and I'm like, okay, I come from a city which is of course not totally insecure, but there are several areas I know I cannot attend if I want to um, keep safe. So when I had patients when I was working in primary care, and I had patients of these kind of dangerous or like depressed areas, I need to consider that. Like I should have like a map, kind of a city map in my mind before saying, hey, no, yes, of course you can do 10K steps per day. You just need to go out and walk. Like it's not that easy. So I'm pretty glad you are considering that. And of course, it's not fair that the only alternative in some cities is like, let's go to a gym and let's pay a membership. Like that's not possible for all the people. Even for me as a student is pretty hard. Like right now actually going to the uni gym with their limitation, with its limitations and stuff, because it's not the most responsible financial speaking decision to pay for a private gym. So what could I expect for my patients? Like, and if you talk about global south, you have a lot of rural areas, a lot of problems with security. So I'm pretty glad you are having this focus, because the only solution it cannot be let's pay for a membership when you need to pay first for the food or for meds or for your essential necessities. And also, I think we have a pretty, I would say, a huge gap in our education as medical doctors, for example, in exercise prescribing, because of course it's not enough just to say yes, you should do exercise. Like when I talk with my parents, they are just like, yes, okay, but how should I start? And you can give a few tips based on your own experience, but those are not that is not professional advice. And if you are looking for a private nutritionist or like a personal trainer, usually the fees are also pretty high. So it seems like a vicious cycle. Sometimes you cannot see how to go out of this cycle because you find poverty, scarcity, insecurity. But I think it's a pretty good start to put the questions in the center, like and think and reflect about it. So thank you very much for your conference and for your job, Serena.
Thank you. I appreciate that. And I like the way you also highlighted there at the end as well. That as a doctor, it's really like you don't get taught that. And I think that's also one of the fundamentals is like education. When we went into those schools, those kids had never had a conversation on nutrition before either. And I was thinking to myself, like, okay, it's 2025. How we all know as a population now how important nutrition, how important your health is. So like why hasn't it been integrated into an educational setting? Um yeah, and then I also do feel though that there is a lot of pressure on doctors. I think that's also one of the reasons why I got into public health. My mom is also a doctor, and I see the pressure that doctors are faced with every day. You guys have so much to study. You study for like a minimum of 6 years, and you have to learn so many things. And that's a lot to take on. And then if you are requiring doctors to additionally learn all these things about nutrition and about sports, I think that that creates a really unfair imbalance, and puts a lot more pressure on the doctors. So that's kind of why I thought like, okay, I, as a public health professional, I can be that person that people can go to for those answers. And then hopefully, well, ideally in a preventative setting, you then prevent so many people from going into the hospital in the first place. And that then alleviates pressure from those doctors. Um, so yeah, I think it's really interesting though, and thank you so much for giving your insights also into your home country as well.
If anyone does have any questions, please feel free to send me an email. It's fthenetwork@gmail.com. And I can send those along to Serena or any of our other speakers. But with that, I would just like to thank everyone for their time. Thank you to our speakers. And thank you to all of you for joining us. And if you haven't already, please fill out the attendance form so we can make sure that those of you who have been consistently attending get your certificate. With that, I hope everyone has a great night, and it was so great to have you all.